I'm presenting about sleep physiology and its relationship to cardiopulmonary system. So sleep could be described as a state of partial unconsciousness or diminished skeletal muscle activity and or depressed metabolism. Um, to measure multiple physiological variables to identify different phases of sleep or sleep disorders, we use a device called polysomnogram, which includes EEG to measure electrophysiological changes in the brain, or EOG to monitor eye movements, and EMG to monitor muscle activities. To briefly mention a couple of things affecting sleep, factors includes age, illness, environment, fatigue, lifestyle, stress, alcohol and stimulants, or diets, or smoking, motivations, and medications. Common sleep disorder that people experience nowadays are hypersomnia, which is a sleep of excessive depth or abnormal durations, or narcolepsy, which is caused by a sudden sleep attack that lasts from seconds to several minutes. And fun thing about narcolepsy is that it may be heritable from your parents and is classified as hypersomnia. Sleeper with narcolepsy may also experience cataplexy, which is a loss of muscle tone and paralysis of voluntary muscle triggered by emotions. And they also may experience visual or auditory hallucination at the onset or offset of sleep. And insomnia, which is the most common sleep disorder that people have nowadays, is defined as an inability to fall asleep. And condition of insomnia lasting less than a week is called transient insomnia, and insomnia lasting 1 to 3 weeks is called short-term insomnia. And lastly, insomnia over 3 weeks is called chronic insomnia. And another sleep disorder that is common nowadays is called sleep apnea, which sleep disorder is characterized by the temporary absence of breathing during sleep. A subset of sleep apnea is called obstructive sleep apnea, which is the absence of airflow through the nose and mouth with the persistence of diaphragm and intercostal muscle activities. And sleeps or central sleep apnea is characterized by the absence of airflow with no respiratory efforts, which means that there's no diaphragm nor intercostal muscle activities. And lastly, mixed sleep apnea is characterized by an initial absence of airflow with no respiratory effort, followed by a period of upper airway obstruction. And periodic limb movement disorder, also known as PLMD, is a repetitive stereotype movement of the leg muscle during sleep, with a rhythmic pattern occurring about 30 seconds apart, and is most likely occur during the non-REM sleep. And lastly, restless leg syndrome, also known as the RLS, is an intense, unpleasant feeling described as crawling, prickling, tingling, burning, or painfulness sensations on your leg. And these crawling sensations occur mostly between the knees and ankles. To talk a little bit more about the EEG waveform, which again measures the electrophysiological changes in the brain, four most common waves are first beta wave, which is also known as the busy wave, which has a characteristic of relatively low voltage and a frequency greater than 13 hertz. And alpha wave, which is also known as the relaxed wave, has a relatively high voltage and frequency of 8 to 13 hertz. And the significance of the alpha wave is that the alpha wave indicates that the brain is in the calm and relaxed state of wakefulness. And third, theta wave, also known as the drowsy wave, has a relatively low voltage and relatively low frequency of 4 to 7 hertz. And lastly, delta wave, which is the slowest wave among the four waves, has a frequency of less than 4 hertz and a high amplitude. And these are the EEG throughout sleep. And before sleeping, sorry, before sleeping, we can divide this phase as an eye-opening wake phase and eye-closed wake state. During eye-open wake stage, we can see beta and sawtooth waves on the EEG and low, frequent, and variable eye movement on EOG, and can monitor high muscle activity throughout EMG. And during eye closed wake stage, we can see dominant alpha waves through EEG and slow rolling eye movement through EOG and high muscle activity through EMG. Throughout sleep, there are two major phases. First phase called the non-REM, also known as the non-rapid eye movement sleep. This stage accounts 75 to 80% of the sleep, with N1 stage of non-REM accounting 3 to 8% and N2 stage accounting 45 to 55% and N3 accounting 15 to 20% of the sleep. And then the second stage of sleep, also known as the REM or rapid eye movement sleep, accounts 20 to 25% of the sleep.
Hello, my name is Quintavia. I'll be talking us through the stages of sleep as well as what a full sleep cycle is like. So starting with our non-REM stages, we'll start with N1, where these are the light sleep stages. N1 is the transitional stage between drowsiness and sleep. Um, what we will learn later is our sleep latency. This happens before this N1 stage. This is about 3 to 8% of our sleep. And during this stage, you may experience hypnic myoclonia. Visible on our polysonogram is the alpha waves, theta waves, and some beta waves, the vertex at the end of N1. Next, we see on our EOG the slow rolling eye movements. And lastly, we see our decreased activity and muscle relaxation. Key features on this stage is the breathing becomes regular, heart rate, blood pressure slowly decrease, and minute ventilation and cerebral blood flow and muscle tone diminish. Our second stage is our N2 stage, which is where most of our time is spent, which is 45 to 55% of our sleep is spent here. Our heart rate decreases, blood pressure decreases, temperature decreases, and respiratory rate all throughout this stage. Uh, as you can see on our polysonogram, our EEG becomes a little bit irregular, predominant theta waves, intermixed with sudden bursts of sleep spindles and one or more K complexes, as you can see by the color-coded boxes on our graph. Secondly, we will look at our EOG, which is our slow eye movement, or the absence of slow eye movement, and EMG is low electrical activity. Our non-REM stage 3 is N3, which is slow wave sleep. This is about 20 to 24 minutes after stage 1. Here, our heart rate decreases, blood pressure, temperature, and respiratory rate, as well as adding in our oxygen consumption decreasing as well. This is where the start of our dreams happen, which is the less dramatic part, probably the part that we don't remember the most. Visible on our polysonogram is our EEG, our sleep spindles and K complexes may be present. Our delta waves are also dominant here. Uh, EOG has little or no eye movement, and our EMG has low activity. Some key features here is our skeletal muscles are very relaxed, but the tone is maintained. Our heart rate is decreased, blood pressure, body temperature, and oxygen consumption, and also keep in mind that dreaming can start in this stage as well. More in depth into this N3 stage, which is our deep sleep stage. Important for mental and physical restoration. This is also where some children, maybe adults, may have bedwetting, night terrors, and sleepwalking occurring in this stage. And lastly, this is about 20 to 30% of our normal heart rate and respiratory rate during this stage. So very slow breathing and very slow heart rate. Visible on the polysonogram is our EEG, which is a predominant delta wave. Our EOG shows no eye movement, and our EMG shows little to no electrical activity. lastly, everyone's most favorite part of sleep is the REM sleep, which is where our brain activity increases more than normal, which is where we get our more in-depth and more detailed dreams. Uh, our heart rate and blood pressure fluctuates from those dreams. When you react to your dreams, your blood pressure and your heart rate changes. Some key features in this one is our EEG shows our sawtooth waves and our alpha wave. Um, Frequent sawtooth waves and alpha waves may be present, showing our activity, as well as in our EOG, we have our REM activity. Our EMG shows our low electrical activity and temporary paralysis of most of the skeletal muscles, which is sometimes how people get sleep paralysis when they wake up in the middle of the night and their body is not ready to wake up. Our heart rate becomes inconsistent with episodes of increased and decreased. Also, it is very important to remember that when the sleeper is very tired, the duration of each REM period is very short or maybe even absent. As a person becomes more rested throughout the sleep period, the length of REM sleep becomes more increased. Now we will walk through all the different normal stages of what a normal sleep cycle will look like. So as I told you guys before, we will talk about sleep latency, which is the time that it takes you to fall asleep. So for most people, it's about 10 to 30 minutes that's required to fall asleep. If you take less than 5 minutes to fall asleep, then you were very tired and you probably should have went to sleep a little bit sooner. If you took more than 30 minutes of sleep, you probably had a little bit of too much energy, too much brain activity, or you had an emotional stress or environmental disturbances or medications, illnesses, or any pain that may be caused. There's a video here that shows a little bit more in depth of each stage, walking through the sleep stages and telling you a little bit more detail. Also, it's a little bit more bite-sized so we can see in colorful images. Next, we will walk through a full sleep cycle. So a full sleep cycle begins in N1 and ends in REM. As you can see, we don't just go from N1 to N2 to N3 and then to REM. We go from N1 to N2 to REM, back to N2, then to N3, and then back to N2, and then to N1. So it doesn't go smoothly as we might think. A full cycle takes about 90 to 110 minutes. That is something that we need to keep in mind. Also, throughout the night, as the sleeper becomes more rested, they go through more cycles. So on average, the cycles are about 4 to 6 in a normal night's sleep. So a normal 8 hours of sleep was about 4 to 6 cycles of a full sleep cycle. Normal young adults move from N1 to N3 in about 30 minutes. And then older adults often bypass REM sleep altogether or awaken. And here's a question that might get your brain a little bit rumbling. Why do we transition from REM to N2 at the end of a sleep cycle instead of REM to N1, since N1 starts a new cycle and REM ends a cycle? The answer to that question is we go back to N2 because a regular sleep pattern has a transition to deeper sleep to lighter from deeper sleep to lighter sleep and vice versa. And N2 is deeper sleep stage than N1. And also, as we remember, uh, N2 we spent the most of our sleep in that section, so we obviously have to keep going back and forth, back and forth. A full sleep cycle. So this will break it down into each age group. So newborns need about 16 to 17 hours of sleep divided into 7-hour periods. So obviously people wake their babies up to eat every so often, sleep, change their diaper, take a shower, all those things. Babies sleep a lot because they grow fast. Infants typically awaken every 3 to 4 hours to eat. Same for the newborns and infants, they're about the same. Infants, they need to be awake more because they have to eat more. Newborns, they can sleep a little bit more. 50% of sleep period is spent in non-REM sleep in 1, 2, and 3, and 50% in REM. As you will see, as we get older, those percentages change throughout our lifespan. Once we reach about 4 months, we sleep through the night and take short naps throughout the day. Um, Most of us have seen babies and they are pretty cranky when they don't get any sleep. After one, we sleep for about 14 hours a day and take 1 or 2 naps throughout the daylight hours. Full sleep cycle, again, as I will just remind you guys, toddlers take about 14 hours of sleep. So toddlers, I put that age range about 1 to 2, because after two, our sleep decreases, our sleep need decreases. We only need about 12 hours a day. So instead of 2 naps, we only need that 1 nap to get through the day. And then also, once we hit that 3 to 5 age, our REM sleep decreases to about 30% slow wave sleep. Children sleep about 8 to 12 hours, which is after 5 years old. Children and adolescents kind of overlap a little bit. But throughout this, 20% of our sleep is done in REM. Same for the adolescents, about the same. 20% is done in REM. We need 8 to 12 hours. The young adults, which is about our age, typically requires 6 to 8 hours of sleep, and 20% of that is done in REM. So we have a harder time waking up most of the time, but we are typically more rested. Our number of arousals increases. So as we get older, it's easier for us to wake up in the middle of the night and continue to wake up in the middle of the night. Older adults, they need about 6 to 8 hours as well. 20%, 20 to 25% of their sleep is spent in REM. So they get a little bit more, but not much. A longer sleep latency, so it takes longer for them to fall asleep as you get older. And lastly, we have our normal cardiopulmonary
Oh, wait,
physio.
I'm gonna do that one.
Oh, just kidding.
We'll have to edit that out. Okay. Um, Hi, my name is Paige, and I'm going to be talking about the normal cardiopulmonary physiology during sleep. So, the autonomic nervous system, the parasympathetic activity increases at sleep onset and continues throughout non-REM sleep. The parasympathetic tone increases during the transition to REM sleep, and the increased parasympathetic activity causes numerous autonomic service nervous system changes in the musculoskeletal system, the respiratory, physiology, cardiovascular function, and sleep-related dysrhythmias. Okay, for the musculoskeletal system, the skeletal muscles typically have their highest tone during the wakeful state. The muscle tone decreases with sleep onset and throughout non-REM. During REM sleep, the muscle tone is at its lowest. It's temporarily in a paralyzed state, which allows the tongue to fall back into the oral pharyngeal area during inspiration, and this can lead to obstructive sleep apnea. The least affected muscles are the eyes and the diaphragm, which is typically why people do not act out their dreams during sleep. So, for cardiovascular function during non-REM sleep, the vagal nerve function provides relative automatic stability, heart rate, and blood pressure. They follow a sinusoidal, I do not know if I pronounced that right, pattern called nocturnal dipping. And nocturnal dipping is when the heart rate and the blood pressure briefly increase to accommodate venous return and increased cardiac output. And during expiration, there's a gradual decrease in heart rate and blood pressure. And during REM sleep, heart rate becomes variable with episodes of increased and decreased rates. Heart rate may increase as much as 35%. And so for respiratory physiology, the medulla's ability to respond to the partial pressures of oxygen and carbon dioxide changes is reduced during non-REM sleep. So during non-REM sleep, the respiratory rate decreases, which causes the ventilation per minute to decrease about zero point 0.5 to 1.5 liters per minute. And this reduction is caused by decreased metabolic rate reduced ability for the medulla to respond to ventilatory signals during sleep, the decreased sensitivity of the partial pressure chemoreceptors to and signals to the medulla during sleep, and the increased airway resistance caused by reduced muscle tone in the upper airway. And so other changes from increased tone that can take place is thermal regulation. During non-REM, the body temp can decrease by 1 to 2 degrees Celsius. During REM sleep, it can increase the body temp. For renal function, there is a decrease in urine production via decreased renal perfusion and increased water reabsorption. Um, as far as genital function, specifically for males, erection can start at the beginning of REM sleep and it can continue throughout and then be lost at the end of REM sleep. For GI function, there is decreased salivation and swallowing, and there's peak gastric juice secretion between 10 p.m. and 2 a.m. And then for endocrine function, there's peak plasma growth hormone during N3 stage, which is about 90 minutes after the onset of sleep. And there's peak ACTH and cortisol secretion between about 4 a.m. and 8 a.m. Oh, other changes from increased tone continued. So sleep-related arrhythmias during non-REM sleep, there's increased vagal nerve activity, which can lead to decreased heart rate, blood pressure, and cardiac metabolism. This can lead to reduced cardiac dysrhythmia risks and increased risks of myocardial hypoperfusion. During REM sleep, there is an increase of autonomic activity, which can lead to an increase in heart rate and blood pressure. This can lead to increased cardiac dysrhythmia risk and things like PVCs, tachycardia, atrial fibrillation, and cardiac asystole are all possible during this time period. And this can also lead to a reduction in oxygen supply. As far as cerebral blood flow during the non-REM sleep, cerebral blood flow decreases, and during REM sleep, it increases. Spinal cord blood flow also increases during REM sleep, and so does cerebral metabolic rate. And so, on to the functions of sleep. The main purpose of sleep is for restoration and energy conservation. It's normal in young adults to wake up between 1 to 2 times throughout the night. The number of times that you wake up and the duration of each episode tends to increase with age, and the duration of non-REM and REM sleep varies with age. It is known that the brain is really active during sleep, and extreme sleep deprivation can cause lack of focus, impaired memory, depression, paranoia, hallucinations, and mood swings. So, for restoration and conservation, during non-REM sleep, it promotes physical growth and healing. So, the release of growth hormones in children and adults happen during this stage. REM sleep plays an important role in the restoration of processes such as attention span, learning and memory, emotional healing, and performing basic social skills. And there's such thing as the energy conservation theory, which states that as energy requirements decrease with age, the need to conserve energy also decreases. So as we get older, we don't need as much sleep as we did when we were younger. And the decreased slow wave sleep in older adults is likely the decreased need to conserve energy, which contributes to this conservation theory. And for circadian rhythms, a circadian rhythm is the biological rhythm that occurs at regular intervals of about 24 hours. Examples of this include sleep and wake cycles, cortisol level changes, and body temperature fluctuations. A circadian synchronization is said to correspond with like a good sleep and wake pattern. And it's an individual sleeps when psychological rhythms are at their lowest and they're awake when levels are at its highest. And sleep depth is based off of the assumption that everybody has a certain requirement for the amount of sleep they need, and anything that does not meet that requirement is considered a loss of sleep. So the sleep depth is just that combined loss overall, and is the number one thing, there's number one sleep related problem affecting most people today. And these are our resources. We hope you enjoyed our presentation and learned some things.